I see several team members still joining, so welcome. And we're excited to have you here at our workshop, the Child and Family Wellbeing System. The economic and concrete supports is a core component. We're looking forward to supporting you today with any questions and information. And one of the couple things just for housekeeping, this presentation will be recorded. It is being recorded. We will be utilizing it for any members that were not able to attend today. Also, we wanted to ask if you can rename yourself, just maybe adding the agency, the county you're joining us from. So it's useful for us, helpful to know who is in the room. And also, we will be utilizing the chat function. Feel free to add any questions or thoughts. Our speaker will be taking questions as we move through the presentation, and she will also have a Q&A at the end in case you're not able to ask a question during the portion that she's releasing information you would like to know more about. I'm going to ask if you could also mute yourself just so we can avoid some distractions. And again, I'm here to support. So any questions you may have, again, I will respond via chat, and we will also pause as we go and ask our speaker to provide additional information. Any questions you have for us before we get started? Okay, I don't see any. Oh, thank you. Welcome, welcome, Sarah. Yes, if you would like to also add who, introduce yourself in the chat, feel free to do so. And I will and pass it on to our presenter, Yasmin Grewal. And then I'm not sure, how do I say, is it last? How do you say your last name?
It's Yasmin Grewal-Koch.
Okay, perfect, excellent. A policy fellow, and she is presenting on the Child and Family Wellbeing System. This is the economic and concrete supports as a core component. Very important, especially in the prevention work that we do. Okay, so Jasmine, please begin the presentation. We're looking forward to hearing this great information. Thank you.
Thanks so much, and good morning, everyone. As she said, I'm Yasmin Grewal-Koch, and I'm a policy fellow at Chapin Hall, and I co-lead our portfolio focused on economic and concrete supports. Thank you so much for the opportunity to present to you all today. I'll be talking about the intersection of family, economic insecurity, and child welfare involvement. And then I'm going to focus on what the research tells us about the relationship between access to economic and concrete supports and risk for child welfare involvement across a comprehensive body of evidence. I'll be focusing on some new research with you all today. I'll also be sharing some new Chapin Hall resources that you may find helpful. And I'll also discuss some family first opportunities related to economic and concrete supports. As was mentioned, we'll have some time in the middle of my presentation to share some reflections, because I'll be sharing a lot of information with you all today. And we'll also have time for some Q&A at the end. So if you have thoughts or questions, please feel free to put them in the chat while I'm presenting, and we'll definitely come back to them at the end. So let's start with what exactly do we mean by economic and concrete supports? We consider economic and concrete supports broadly as financial assistance and material goods and services that are provided directly to families, including things such as cash, public benefits, tax credits, employment, housing, childcare, legal support, and health care. This slide provides a high-level overview of the body of research on the association between economic and concrete supports and child welfare involvement. In general, reduced access to economic and concrete supports is associated with increased risk of child maltreatment and child welfare involvement, while increased access to economic and concrete supports is associated with decreased risk of child maltreatment and child welfare involvement. This ever-growing body of evidence is consistent across time and types of studies. The evidence is also consistent across mechanisms, meaning that economic and concrete supports are associated with reduced risk for child welfare involvement, regardless of the type of support that's provided to families. And importantly, economic and concrete supports evidence is actionable. It can inform evidence-based policymaking and the types of services and supports that we choose to provide children and their families to keep them together and to prevent unnecessary separation. Chapin Hall's systematic review of the research on programs and services that provide economic and concrete supports was recently published. You can access both the publication and an overview that we prepared to make it very accessible via the links on this slide. And I do believe that you all will have access to this slide deck after the presentation, because there's a lot of really great information and there are links embedded in the slides that I hope that you can use.
I'm sorry, can somebody please turn off the chime? I think it's a setting on the screen. It's just really distracting trying to listen to you and the doorbell chime keeps chiming in.
Yeah, I appreciate that. Maybe, Lucy, there's something we can do about the chime.
I'm looking into it right now. Thank you.
So our systematic review found that regardless of delivery mechanism, there's favorable evidence of the impact of economic and concrete supports as a prevention strategy to reduce child maltreatment and child welfare entry. So let's talk briefly about the relationship between family economic insecurity and child welfare involvement. Data shows us that consistently around 60% of substantiated child protective services responses nationally involve neglect only. I highlight this number because we often suspect that cases involving neglect are secondary to poverty. I want to point out that the research shows us that the provision of economic and concrete supports to families is associated with decreased risk for child welfare involvement due to both neglect and physical abuse. So we do need to look beyond just the neglect numbers. I also just wanted to ask everyone to put themselves on mute. I'm just hearing some background noise. It would be helpful if we could just mute everyone.
Like recently there was an incident with that, and like I know mom was saying they were trying to connect her with counseling.
Are you able to do that, Lucy?
Yeah, I'm looking for the
Mom,
person. I
so-
can't
oh,
find
she
who's,
sent me right down.
sorry.
Her ID number
Yes,
and-
go ahead. I'm trying to find the,
It was Alejandra, I think.
okay.
Yes.
She's really doing outreach.
So recent legislation in California narrows the definition of neglect and aims to prevent children from entering foster care for reasons of economic hardship alone. We're seeing this type of legislation increasingly across the country. AB 2085 clarified that mandatory reporters should not make referrals based solely on parents' economic disadvantage. And SB 1085 prohibits children from being removed solely due to homelessness or poverty. It'll be interesting to learn what the impact is of these reforms in California, particularly because it's estimated by the Legislative Analyst's Office that around 54% of child welfare involved families in California earn less than $1,000 a month. While research demonstrates there's a strong relationship between family, economic insecurity, and child welfare involvement, it increasingly indicates that families who experience material hardship may be at particularly high risk for child welfare involvement. We usually think of material hardship as difficulty paying for basic necessities such as medical care, utilities, housing. This study found that in fact, material hardship is a consistent predictor of contact with CPS. Unmet basic needs pose a remarkably consistent risk for CPS contact over and above income poverty. Evidence demonstrates that material hardship is directly associated with an increase in parents' emotional distress, which in turn is associated with an increase in their child's emotional distress. This is what the Stanford Center on Early Childhood calls the hardship chain reaction. Material hardship is common amongst families in the United States, and particularly amongst families in California. This rapid survey out of Stanford found that in 2023, half of California parents with young children reported having difficulty paying for basic needs. 75% of parents surveyed reported experiences of emotional distress, and 75% of parents reported that their children were experiencing emotional distress. We created this visual at Chapin Hall based on the evidence to show how multiple hardships can overload families and increase their risk for child welfare involvement. You'll see as more boxes get loaded on this truck, it starts to break down. But what happens to families when we start to take those boxes off the truck bed? We'll explore what the research tells us a bit later in this presentation. Families, of course, know best what they need. I want to share this framework from the Children's Trust Fund Alliance Birth Parents National Network. It's called Building a 21st Century Community-Based Approach to Strengthening Families. And it clarifies, from the perspective of parents with lived experience, the need to redress child and family poverty and increase economic and concrete supports. I know the text on this slide is a bit small, but you can spend more time with this framework if you click through the link on the bottom right side of this slide. You'll see listed in this framework many of the policies and supports that I'll be talking about today, including paid family leave, tax credits, healthcare, housing, childcare, job opportunities, and social supports. What really stands out to me is at the top left, that call for a humanitarian society. This represents a mental model shift and policy framework for using funding differently than we currently do to ensure that all families have what they need. So let's now turn to what the evidence tells us about the relationship between economic and concrete supports and child welfare involvement. What does the evidence suggest happens when economic and concrete supports are reduced? Based on the research we've compiled at Chapin Hall, this slide provides an overview of the types of economic and concrete supports that, when decreased, are associated with increased risk for child welfare involvement. This includes reduced TANF benefits, lack of childcare and stable housing, reduced employment and income, increased gas prices, meaning that families have less disposable income, and increased regressive taxes. We'll focus on only a couple of these studies today, but you can find details about each of these studies in the comprehensive deck that's available on Chapin Hall's website, and I'll be sharing that link later on in my presentation. So let's start with TANF. There is a growing body of evidence about the relationship between TANF and child welfare involvement. So TANF is CalWORKS in California. This study found that states that implemented total benefit loss as the most severe sanction for not meeting TANF work requirements saw significant increases in substantiated neglect reports and foster care entries. When one looks at this impact, it's important to keep in mind the first statutory goal of TANF, which is to provide assistance to needy families so that children can be cared for in their own homes or with relatives. According to the most recently available public data, states are holding up to $7.75 billion in federal TANF funds in reserve, which they are allowed to do. I will note that California is one of the few states with an unobligated TANF balance of only $0. So it's been using all of its TANF funds. The authors of the study I just shared followed up with this more recent study, which examined the effect
Your microphone's off.
Can everyone hear me now?
We can hear you now. Sorry.
Okay, let me just start again with this slide. The authors of the study I just shared followed up with this more recent study, which examined the effect of state policy choices that restrict access to TANF benefits for families. It found that each additional state policy that restricts access to TANF is associated with an additional 50 children with substantiated neglect reports, 22 children entering foster care due to abuse, and 21 children entering foster care due to neglect. And this is per 100,000 children. You can see the box on the right describes the specific TANF policy choices that this study considered. Throughout this presentation, I'll be linking the research findings to concrete examples of policy options that may reduce family child welfare involvement. Several years ago, a bold new vision was introduced by David Burns in El Paso County, Colorado, to align TANF and child welfare. It grew out of the recognition that many of the families involved with the child welfare system are also involved with the cash assistance program. This vision reframed TANF as a child abuse and neglect prevention program, regaining its historical role as a family preservation arm of child welfare. And at the same time, it broadened child welfare services to embrace economic issues. Under David Burns' leadership, the number of families receiving TANF cash benefits increased, the number of children placed in out-of-home care declined, and the overall foster care population declined. This vision was one of the reasons for the creation of California's Linkages Initiative, and it elevates the importance of aligning child welfare and TANF programs. There's also quite a bit of evidence on the relationship between access to childcare and child welfare involvement. The study in the top bullet on this slide found that for every childcare concern reported by families receiving TANF, the risk of supervisory neglect increases by 20%. Another study found that mothers entering substance abuse treatment who have difficulty securing childcare are 82% more likely to self-report child neglect compared to mothers entering treatment who didn't have difficulty securing childcare. It's particularly interesting to note that difficulty finding childcare was a stronger predictor of maternal neglect than almost any other factor measured in this particular study, including mental health and severity of drug abuse. It's estimated that inadequate housing contributes to the risk of entering foster care for 1 out of every 6 children involved in CPS investigations. This slide provides an overview of the body of research on the relationship between housing stress and increased risk for child welfare involvement. You can see the specific types of housing stress that have been associated with increased risk for child welfare involvement. It includes child maltreatment, CPS investigations, substantiations, and foster care placement. I also want to point out that the most recent data from HUD indicates that families with children make up 1/3 of the total homeless population in the United States. So I've shared a lot of information already, and I wanted to just take a brief moment to hear from you. Feel free to share something that you learned or something that was surprising to you in the presentation so far. You can put your thoughts in the chat. You're welcome to come off mute. I would love to hear from you.
Hi, this is Jamie Alexander from San Joaquin County. I think it just reinforces some of the work that we're doing and the need to make sure that our families do have childcare and that's shocking to me about the childcare piece. It is, but it isn't. I guess I should say that about the childcare piece and just the need to reinforce having availability of these resources. And for me personally, it creates a lot of anxiety with the way the world is right now. And just, reading the most recent, decisions to decrease SNAP benefits and Medicaid and all of these things that are just going to continue to become harder and harder with the families we serve. So we already have problems with these resources and it's going to get harder. And so it just, for me, I hear the importance of all of this. It's just so eye-opening even more, and I'm in the field and already believe it. So it's just, it's informational, what causes even more anxiety.
I appreciate you sharing that. And I don't want it to cause increasing anxiety for everyone, but it is difficult with the current context that we're living in. I do hope that some of the resources I share and some of the research I share just helps you consider further aligning across your programs to support families, despite some of the complexities that we anticipate. And I'll be sharing more research about Medicaid and SNAP, which is important given the proposed cuts. Did anyone else have anything else they wanted to share? I'm happy also to talk more at the end of my presentation, but wanted to give you all a chance.
I'd like to just make a quick comment. One is to focus again on the fact that in California, we expend all of our TANF funds, which is a good thing. That it's not enough, of course, is a situation that's national. But also that, just recently we've been able to continue and James, I know you're on here. You can jump in and correct me when I say this quite not correctly, but we've been able to continue cash aid when families move from family maintenance to family reunification and child welfare. So we can continue that for 6 months, because all of the data that you've presented today was information that was given to us probably almost 2 years ago by Caltrin when we were doing a lot of the work around creating family first prevention services. So it's, it's overdue, but at least it's in place now. And hopefully we'll see more reunification as opposed to families moving into foster care. Thanks.
Yeah, and I don't have a slide on that in this presentation, but we do have a slide in our larger presentation about the policy option of allowing families who are working towards reunification to keep those benefits, because there is several studies that show that families who have access to more income or public benefits or maintain that TANF after their children are taken away have a much faster and higher likelihood of reunifying with their families. So I'm aware that California has decided to implement that policy option. Not all states do, but we do think it's really important. All right, I think I'm going to go on with my presentation because I still have a lot more to share, but we'll have time at the end to come back to any other thoughts and questions. So let's turn now to what does the evidence suggest happens when economic and concrete supports are increased for families? So here's a summary of the types of economic and concrete supports that, when increased, are associated with decreased risk for child welfare involvement, based on the research that we've compiled at Chapin Hall. They fall into 4 basic categories: macroeconomic supports, concrete supports, public benefits, and child welfare interventions augmented with economic and concrete supports. I'll be sharing some findings from some of the newest studies today. This recent working paper analysis found that on average, an additional $1,000 unconditional cash payments to families in the early months of a child's life is estimated to reduce the likelihood of a CPS referral for neglect by 10%, a referral for physical abuse by 30%, a substantiated CPS referral by 15%. That's all until the child reaches age 3, and child mortality by 30% through the time the child reaches age 5. We're seeing that targeted supports to families with young children, which is an extremely important and vulnerable time, can have a large impact on reducing your risk for becoming involved with the child welfare system. There's a growing body of evidence showing that tax credits are associated with decreased risk for child welfare involvement. This study looked at the impact of the enhanced COVID-era monthly CTC payments that were sent directly to families for 6 months. It found that these payments were associated with an immediate almost 14% reduction in calls to the National Child Abuse Hotline. And following the expiration of the enhanced payments, there was a gradual daily increase in hotline calls over time, particularly for neglect. This recent working paper analysis, which is based on California data, found that an additional $1,000 in child-related tax benefits to low-income families during a child's first year is associated with reductions in the number of CPS referrals, investigations, and substantiations by around 3 to 4%, and days spent in foster care by 8%, up to the time the child reaches age 3. This study found that infant maltreatment investigation rates declined over time in states, including California, that enacted paid family leave policies compared to states that did not. It also found that state paid family leave policies may be especially protective for infants in states with high levels of family poverty and for adults without a high school education. Research shows us that access to Medicaid and healthcare is associated with reduced risk for child welfare involvement. This study found that state-level increases in child healthcare coverage rates, and that included both Medicaid and private coverage, are associated with decreases in substantiated reports of physical abuse. Coming back to childcare, this study found that states with more generous income eligibility policies for childcare subsidies, meaning that more families could access childcare assistance, have lower physical abuse and neglect investigation rates among children under 5, compared with states with less generous policies. It estimated that if Michigan increased its maximum monthly enrollment income by $700 for a family of 3, around 1,200 fewer children under age 5 would be investigated for neglect, and 528 fewer children under age 5 would be investigated for physical abuse, and that was over a 1-year period. This study found, based on data from Los Angeles County, that neighborhoods with higher percentage of 3- and 4-year-olds attending preschool are associated with lower rates of child maltreatment investigations and substantiations. This Health and Human Services supportive housing demonstration study found that families with children at risk of removal who received supportive housing experienced fewer foster care placements, improved housing outcomes, and less intimate partner violence. And this was after 5 years, and it was compared to families who received the usual services. This was a randomized control trial. To address the housing needs of families involved with child welfare, Wisconsin launched its Family Keys program. It provides short-term housing funds to families with children at risk of removal due to housing insecurity and to families unable to reunify due to inadequate housing. These funds can be used for hotel costs, short-term rentals, and expenses related to finding and maintaining housing. Now we'll turn back to TANF. This study examined the effect of state policy choices that restrict access to TANF benefits. It found that easing TANF restrictions, so making it more accessible to families, is associated with fewer children with substantiated neglect and fewer children placed into foster care. It estimated that around 29,000 fewer children would have entered foster care nationally from 2004 to 2016 if states had eased TANF restrictions to increase access for families. The Fiscal Responsibility Act of 2023 authorized an opportunity for 5 states to pilot alternative performance measures instead of the current work participation rate for TANF. Alternative measures must include indicators of child and family well-being and can include child welfare involvement. This is a unique opportunity to build new evidence aligned with the first statutory goal of TANF, which I shared before, which is to provide assistance to needy families so that children can be cared for in their own homes or with relatives. It's an opportunity to align TANF and child welfare. California was one of the states selected to participate in the pilot, which is very exciting. This longitudinal study found that children from low-income families who participated in SNAP or WIC had a lower risk of experiencing substantiated maltreatment reports compared to children from low-income families who don't participate in either program. I don't have the slides in this deck to share with you all today because we have a limited amount of time, but there are several studies showing that increased access to SNAP is associated with reduced risk for child maltreatment and child welfare involvement. We see that across the country, although overall SNAP participation rate is at around 82%, there is variation across the states. In California, as of 2020, which is the most recently publicly available data that I could find, only 66% of eligible individuals participated in SNAP, indicating opportunities to increase outreach efforts and access to California families. We also see that across the country, many families who are eligible for WIC do not participate, despite its proven benefits. According to this graphic, although California is doing better than most states, only around 70% of those eligible for WIC do receive it, also indicating opportunities to increase outreach efforts. This study looked at families who are provided differential response along with concrete supports. So typically families receiving differential response are determined not to be high risk and are diverted from investigations and instead connected with needed services and supports. This study found that families who are low income and who receive differential response with concrete supports are less likely to experience a subsequent maltreatment report than families who receive differential response without concrete support. Kentucky has a long history of providing flexible funds to meet the concrete needs of families involved with child welfare to prevent more intrusive interventions. Kentucky recently increased to $1,500 the amount of flexible funds available to families participating in Kentucky's in-home family preservation program to meet families' concrete needs and prevent foster care entry. It now also makes available up to $4,000 in flexible funds through community action agencies to meet the concrete needs of families with active CPS cases. This Chapin Hall policy brief focuses on flexible funds for concrete supports as a child welfare and foster care prevention strategy. It provides an overview of the research supporting the effectiveness of flexible funds to meet concrete family needs in the child welfare context. It then highlights family preservation as well as more upstream prevention efforts in Kentucky, Indiana, and Wisconsin that include flexible funds for concrete supports as a core component. You can access the policy brief via the link on this slide. Each of the jurisdictions that I highlight in this brief is using funding in innovative ways to meet families' economic and concrete support needs. As you can see from this screenshot of the brief, it provides details on each of these states' family preservation programs, including eligibility, funding sources for the flexible funds, and total annual budget for the program. You can see by the circle here that Kentucky is leveraging federal Title IV-E funding for flexible funds. So this is for the Family First services they're providing to families that include flexible funds as a component of the service model, such as home builders. I want to note that MST and Intercept, which are also common Family First prevention services, also include flexible funds as part of the model. And there is flexibility to determine the amount of flexible funds that can be provided to families. And that kind of leads me into this last section where I want to elevate some new opportunities to expand economic and concrete supports to families through Family First. So we think of economic and concrete supports as an evidence-based prevention service for child welfare that can be provided as a standalone service or a component of other prevention services and programs. The link on this slide is to a Chapin Hall brief that provides additional background, research, and recommendations. I want to point out some new opportunities to have economic and concrete supports programs reviewed and rated by the Title IV-E Prevention Services Clearinghouse. This is important because prevention services must be reviewed and rated by this clearinghouse in order to be approved for federal Family First funding reimbursement via 4E. The revised handbook that was released last year specifically names economic and concrete supports as an eligible service for review by the clearinghouse if it meets all of the other criteria. The handbook also includes as an eligible example of a skills-based parenting service, an economic and concrete support program that includes financial counseling or educational skills for parents. So a couple things are important about this. First is that parenting programs have been expanded beyond just those that target parenting skills. And they can also now include skills that promote parental protective capacity and children's safety and well-being, which is quite broad. And the example that I shared means that, for example, a direct cash transfer program for parents that includes benefits counseling would be eligible for review as a parenting service. as long as it meets the other criteria. So there'd have to be a manual and the evidence would have to be rigorous. With these new opportunities, we always encourage everyone to submit economic and concrete supports, programs, and services to the clearinghouse for review. This slide shares some Chapin Hall resources that may be helpful if you're thinking about submitting an economic and concrete supports program to the clearinghouse. We have a couple of briefs, and we do have a summary of our submission to the Title IV Prevention Services Clearinghouse from last year that's focused on economic and concrete supports. There's also new federal guidance relevant to Family First that came out towards the end of last year that clarifies that federally reimbursable Title IV child-specific administrative costs. So this is for children with a prevention plan who are referred to Family First services. Those costs can include childcare, transportation, and peer navigation programs. So this means if you have a child that's eligible for an approved Family First prevention service, it has a prevention plan. You can claim administrative reimbursement through Title IV for childcare, transportation, parent partners, peer navigators, to increase engagement and completion of services. So I highlight this because it's a really important opportunity to expand the provision of economic and concrete supports to families receiving Family First prevention services. And you can get 50% federal reimbursement for those services. I'm happy to talk through this more if any of you have any questions. It's a little bit technical. I do want to end with just sharing some new resources that we have at Chapin Hall that I hope you'll find helpful. We just released an economic and concrete support state and federal policy toolkit that has several great resources. And via this link or QR code, you'll find additional economic and concrete supports resources, including many of these. I will note that we just published a brief on Medicaid and the relationship between child welfare involvement, and we will be publishing a brief on SNAP and the relationship between access to SNAP and child welfare involvement. Given the current federal context, people will find that helpful, we're hoping. So with that, thank you so much for the opportunity to present to you all today. I know I shared a ton of information, but I'm really happy to answer any questions that came up for you if there's anything you want me to go into in more detail or would like to discuss.
Just feel free to unmute yourself.
And if there are any comments or questions that came up in the chat, if you might elevate them, I'm happy to respond.
Yeah, there were a lot of thoughts that came through. So I'll go ahead and looks like we do have Anne.
Yeah, I just wanted to say that, first of all, this is a great presentation. Fantastic.
Oh, thank you.
But it's kind of, I don't know, disheartening, because I think all of us who work in the field know that this is all, what the research says is what's happening. But it seems almost impossible to implement what's really needed. I mean, it just doesn't, it's so difficult to get some of these supports for our families. I don't know, I guess it's just a comment. I don't know if you have any ideas about what we can do to push this along.
Yeah, I mean, there's some things that are more, I think, complex and some things that are easier. For example, providing flexible funds to families to meet their concrete needs to prevent more intrusive interventions, or providing funding for housing supports. Some counties do that, some may not, but there's certain things that are like kind of smaller efforts, and certain things that will take more coordination with your partner agencies. I know the prevention plans that counties had to submit in California to access Family First state funding do require a lot of coordination, and I'm hoping that some of that helped move this work forward. You also have linkages, which is a connection between CalWORKs and child welfare that I'm hoping expands. But there's opportunities now with family first that I shared, that I'm hoping that jurisdictions start to really kind of consider. But it will require coordination across several different agencies, which is always can be challenging.
We have Mary who has her hand up.
Hi, good morning. This is Mary Swatowski from Kern County. Yasmin, I really enjoyed your presentation. Thank you. I'm part of the linkages group here in Kern County, and one of our goals is to try to get our CalWorks and our child welfare and welfare to work just kind of working together. And I didn't know is if I took a deep dive into your resources on Chapin Hall ECS resources, would I be able to find maybe a flyer or a handout that staff across child welfare staff and welfare to work staff and eligibility staff to kind of, because your statistics are just so great about how we work hand in hand. But I think when people are in the thick of it, they don't see it. They're just, issuing out benefits. They're processing things. They're not seeing the impact that they're having on children and families. And, especially children. I just wondered, should I dig through? Do you have anything like that in there? Just a dream flyer to help uplift and let staff that don't directly work with children that are in the child welfare system, that they can just see themselves as, the keeping those kids from getting there, So just to empower them a little bit. So that's my question. Thank you.
That's a good question. I don't know if we have the exact thing that you're looking for, but that doesn't mean people have used our research and compiled it into 1 or 2 pagers based on their needs. This 1-pager about our research is literally a 1-pager. I'm not sure if that is exactly what would be most helpful for your CalWorks staff. We do have a TANF policy brief that includes all the research on the relationship between access to TANF and child welfare involvement. And if you want a real summary of all the research, we have this economic and concrete supports policy tool that we co-branded with APHSA that includes all of these state policy options you might consider looking at, aligned with all of the research on reduced risk for child welfare involvement. It goes across TANF, SNAP, WIC. It basically summarizes all of our research, but also includes all of these policy options for consideration to increase access to some of these supports for families, and it's aligned specifically with some of the research findings. So those resources may be helpful to you, and let me think if there's any others I can think of.
It looks like there is a
Thank you.
resource that's being shared in the chat. It looks like CFPIC has a material that they would be willing to share as well.
Great.
And we have Aleda with their hand up.
Hi, good morning, everyone. As everybody else has shared, great presentation. It just, again, reaffirms, right, the efforts right into this work. And one of the things I wanted to share that here in Tulare County, we've been, of course, now for the last couple of years, really focusing in on our CalOR performance measures, right? The CalWorks accountability review. And with that said, not only have we really focused in on our welfare to work staff, but we wanted our Medi-Cal and CalFresh staff to understand the importance, right, of connecting families to services and addressing barriers, right, because we want to be able to them to succeed, right, not just our CalWorks families, because with the CalWorks, we already have great collaboration with our child welfare, right? We have our linkages program, but we wanted to extend that to the rest of our staff, right? So they understand the importance of the prevention work. And some of the things that we've done when we rolled out our CalCIP strategies, we did a roadshow to all of the county with what our strategies were in our county to improve that engagement. And so they understood that work. We also talked about how our services, right, with CalWorks, Medi-Cal, CalFresh, provides that prevention, to that CWS involvement. We also provided some statistics to them so they better understood. We're also rolling out some training to some of the frontline staff, our phone agents, right, as to what they mean, what that means, and how we can connect our families to services, not just our CalWorks families, right, but everybody else. And again, this is continuous work, right? Many of us have been a part of collaborations with our workforce development here in our counties, with our colleges, our school districts, right? And it's going to be continuous work, right? Where we're continuous looking at quality improvement, right? With our processes, with policy. But I just wanted to share that, and I appreciate the work that everybody does. Thank you.
Thanks so much. That's exciting to hear.
Great. And we have Mary with her hand up. Mary, you can unmute yourself. I'm not sure if it was a question or just a
Oh, I
green.
was just clapping.
Oh, okay. Okay.
Yeah, hands not up. Thank you, though.
Okay, perfect. All right, and it looks like there's a question. Do you have a link for the resources? There is some resources that are being shared in the chat. So for CFPIC, if you have the link for the resources shared, it would be greatly appreciated if you would like to put it in the chat box, or if not, we can also receive it at strategies and we can put it up on the resources tab. Just a quick reminder that the PowerPoint and any handouts that we are sharing today will be under your resource tab in today's session. So just sharing that. Any other questions? Okay. I don't see any other questions. However, thank you, Cindy. Cindy did share also a resource in regards to childcare and some of a master plan on how early learning and childcare is being expanded. And so she has added that link in the chat box. Feel free to look into that plan and that resource for your community. And there were just some thoughts, Jasmine, around what you were sharing. People were just sharing about some of the complexities of navigating through application process, working with landlords, just even asking for a W-9, that becomes a barrier for our families to be housed. So there was a lot of thoughts around that, sharing as you were sharing the information.
Mm-hmm.
Anybody else? Mm-hmm. Go ahead.
Oh, I was just saying, I'm going through the chat, and I also saw the comment around unconditional financial support. I think that's like the direct cash transfer programs that were funded a few years ago in California. It'll be really interesting to see the evaluation evidence from those programs, and we're interested particularly in looking at any child welfare outcomes, but also in general, there's a lot of evidence around these programs improving families' well-being. And that's relevant to the clearinghouse because that can be considered a parenting program, as I mentioned. And if we could get a program like that on the clearinghouse, then you could start claiming federal reimbursement for that and providing that as a service to families. So the work that California funded and the results we see, I think will be really important. If anyone has anything they want to share on that, it'd be really interesting to hear, because I know there are many pilots happening in California across different counties.
This is a great opportunity to share what your county is working on. We'll look forward to hearing if anybody would like to share.
I kind of dumped everything I knew about our unconditional financial support program, the pilot, in the chat. I don't know anything more about it. I do know that the evaluation, is going to be key to determining whether or not this gets some broader expansion across the state. And I don't know exactly how many counties were involved in this. We were the only rural county. I think it was 7 counties. And it did start last year. They were actually starting to administer the funds in 2024. So I think it was 2024. It could have been 2023. Time flies when you're having fun, but hopefully we'll see more of this.
Yeah, I agree. That's helpful. I see someone put in a comment, Amy, right, San Diego. Right, that's a specific direct cash transfer program for families at risk of child abuse and neglect. People did use ARPA funding around the country for some of these innovative pilots. It'd be really interesting to get that evaluation, Amy. Looking forward to that. I know that in the next couple of years, we should be getting some very interesting data from so many of the pilots that launched a few years ago. And we'll be hoping that we can encourage those programs to be put on the clearinghouse and be considered a family first service.
All right, any other questions or thoughts or resources you would like to share with the group?
And they'll have access to these slides, right, Lucy? Because there's a lot of links. I won't put the resources separately in the chat.
Yes. And if there is anything that we did not receive from you, if you could just email it to us, we will then ensure that everything's under that resource tab. And we will also have the recordings available. If there are any other workshops that you did not attend that you were interested in attending, they will hopefully be up in the next 48 hours.
All right. With that, thanks so much for all your thoughts. I'm just kind of going to be able to go through some of them right now. Really appreciate your engagement, and don't hesitate to reach out if you have any questions or would like more information.
Thank you, Jasmine. Thank you for all the work you're doing, especially during this time. Data research is so important in the work we do. The work we do is so complex, and so we truly appreciate your leadership in doing this work and your team. So thank you, and thank you for that we get to know you in person, so that now we have a connection and we can reach out to you with any questions.
Awesome.
Thank you. Thank you, everyone, for joining us. Thank you for all the work you do. Again, you are making an impressive change for many of us in this work. Thank you for your commitment. This time is the most critical time for your work and your collaboration and the collective impact that you're doing in your communities. Keep moving forward. Our goal is to provide you as much resource and support and be part of your support system. So thank you on behalf of Strategies for joining us in this workshop today. Thank you.